Thank you. I'm just the orthopedic surgeon, and thank God where I work, the general surgeons are there too. So this is a very simple paper. We just aim to compare two types of fixations of the anterior tibialis transfer after relapse of clubfoot deformity. It was done in São Paulo. My name is Simone Battibugli. It's an Italian name. And it's a prospective study. We aim to just compare two types of fixations. The transfer of the anterior tibialis is a very common procedure after relapse of clubfoot deformity. And we compare two types of fixation, the metallic anchor and also the pull-out technique that I will show. I will try to be very succinct here because I don't know how much you guys are interested in pediatric surgery, orthopedics. So we treated 390 patients in this period with Ponset technique, and 25 patients remained with forefoot supination after the repeated casting once they had the relapse of the deformity. And this is the foot aspect. We can see on the right foot we have a mild supination, and the weight bearing on the foot is shifted to the lateral column. So when the patients are young, we just recast and do the Achilles tenotomy as necessary. And the older patients, one tool that we have to treat these residual deformities is to transfer the anterior tibialis to rebalance better this foot. So we allocated them. It's not a randomized paper, but we consecutively allocated them in two groups for the anchor fixation and for the pull-out technique. And all the surgeries was performed by the same surgeon using the same technique. So we do a medial incision on the midfoot to have access to the insertion of the anterior tibialis. We isolated the tendon and detached it. And after that, we go to the second incision on the lateral side, and we find the third cuneiform, that is the bone that we will transfer the anterior tibialis. Until here, the technique is the same for both groups. We make a subcutaneous passage of the tendon from the medial to the lateral side of the foot. And one group we did the fixation with the anchor in the usual fashion. And in the second group, we drill a hole on the bone, and we attach the suture of the tendon on the bottom of the foot, correcting the deformity. Both surgeries had the same time, almost the same time, and after the surgery, we cast the patients 6 weeks. And our follow-up is not too big, but it's very normal. The both follow-up in the both groups are pretty similar. We had just 2 complications. One was the dorsal foot pain in the patients that we did, in the group that we did anchor. And one patient had a superficial infection. Let me just see if the movie is working. And that's the result of the surgery. Just see if the movie will. Well, the the effect of the surgery is to rebalance the foot, so we have more evertor power to balance the foot. So the residual deformity supinates the foot while the patient is walking, and we rebalance, putting the tendon from the medial side to the lateral side to rebalance the forces. The results were good. We based our results on the functional improvement and evertor power, and both groups had the same good results. Can someone see if I'd like just to show the gait before and after the surgery, if we have time. I will show later. I have it on my USB. I do. The difference of both techniques is that the anchor is more expensive, and I think we should be caring about that. There is no reason to do a more expensive technique if we have the same results with the same technical difficulties to do the procedure. So in the discussion, I just like to tell you that the relapse of the deformity in clubfoot treatment is very common. It varies in the literature between 16 and 55%. And one of the great difference in the treatment is the non-compliance with the brace. And we have a very classical paper published in 2004, published by the Iowa group, that is where Dr. Ponsati works, showing that 88% of the non-compliance families have recurrence of the deformity, while the compliant ones will have just 1% of relapse. So the anterior tibialis transfer rebalanced the foot, and the paper shows very good results without any major complications. And this paper shows that after 1 year of surgery, both groups, the ones that was submitted to the anterior tibialis transfer and the ones that didn't need it, had the same functional outcome. And this is a very nice paper published this year. It's 47 years follow-up, showing the anterior tibialis transfer is very useful for correction of the relapse of the clubfoot deformity, and this procedure does not affect the function. So both techniques are good. There is no difference in complications. Both are safe, and there is no reason to use the anchor since it's just more expensive. That's Dr. Ponsati. Thank you very much.
Thank you so much, Doctor.
Thank you very much for the presentation. I've got several questions. How do you appreciate your results? How do you assess functionality? How do you compare?
It's clinical. We just, how all the other papers do, we assess the power of the inversions after the transfer and the type of walking too, the gait analysis.
Okay, and the question, at what stage do you pick up the patients? They come and referred by the nurses, physiotherapists who saw the patient. How do you differentiate if it is tibialis or clubfoot deformity?
Yeah, the clubfoot deformity is a very classical deformity. Usually they start the treatment very young, as you saw in the picture. It's a congenital deformity, so we see them since the birth. And our first treatment is during the first days of life. So the Ponseti method is a serial casting with progressive correction of the clubfoot. So the clubfoot is a treatment that we start very, very young in life.
Newborns. Okay. Thank you.
Yeah, thank you. During the period of 2001 to 9, did you find any long-term complications during this surgery after?
What's your question? Sorry.
Over the period of 8 years, did you find any long-term complications after having any accidental injury to the leg? Once again, repeated injuries.
I cannot understand what your question is. Sorry.
During this period of surgery and while doing this surgery, did you find any complications?
Oh yes, the only complication was we don't have any major complications. One of the patients had dorsal pain that was a little bit more persistent that we usually have, and we have also in the pull-out technique superficial infection that was very normal and very easy to treat.
Any more questions? Thank you so much, ladies.
Thank you for your presentation. One more.
This is the post-operative movie showing both feet with good function. This one showing the ability to avert when the child is just trying to dorsiflex the foot. So with the transfer from the medial to the lateral side, when the child just tried to dorsiflex, it's also avert the foot because the force is applied more laterally.
Thank you so much. So we
Let
have
me
time
just
for 10
show
minutes.
how the child walks before the surgery. So we can see on the right side that he is supinating the foot actively. So there is no residual deformity structurated, but the child when walking he just supinates because it's too much power of the anterior tibialis. And then we rebalance the foot, transferring it to the lateral column of the foot. Thank you very much. Thank you.